Hi, I'm Emily Michelle. Have you had an opportunity to look through the equipment?
Yep.
You okay with how everything works?
Mhm.
Okay.
Yes.
Okay, understand how the monitors and the suction and everything work?
Yes.
Any questions about anything in here before we get started?
No.
Okay, charge nurse, you're okay with your role?
I'm good.
Yep.
All right, good. How do you feel about your family role? You ready for that? Do you have
Yep.
any questions?
I'm fine.
All right, so I'm going to go ahead and give you an S-bar, allow you to ask any questions that you might have, and then we'll begin the scenario. And you'll continue on until I come and tell you that the scenario ends, okay? So the current situation is, it is the day shift, and you're coming on at 7 a.m. You're working on a medical surgical floor in room XX with George Maverick. He's a 63-year-old patient of Dr. Johnson. He's been experiencing some increase in his pulmonary edema and his heart failure, so he's been on the floor since yesterday for that. His wife, Samantha, is at the bedside. Background on him is that he is Caucasian, he's 6 foot tall, and he weighs 216 pounds and has an allergy to codeine. His past medical history, he had an MI 2 years ago. He also has hypertension, hyperlipidemia, and gout, as well as osteoarthritis in his right knee, which he had a successful arthroplasty for in 2008. His history of present illness is that he presented to the ER yesterday for increasing shortness of breath. He was actually at home with his wife and he couldn't sleep laying down and all, so she called 911 and he came in by ambulance. His social history, he is married to Samantha, as I mentioned, and they have 5 children. Justin, Karen, Kenny, Brad, and Jeff, I believe, are all their names. And he's a business owner. At 6 a.m., the nursing assistant went in there and got vitals for me, and she said that they were all pretty normal. The temperature was 98.4, pulse was 92 and regular, respirations were 18 and regular, and he's on room air, so he was sat at 92%. And his blood pressure was just a little high. It was 130 over 80, but that seems to be typical for him. I think that's where the wife said that his blood pressure had been. You'll have to ask her. So my last assessment was at 4, so 3 hours ago, and at that time I did hear some crackles in his lower lobes bilaterally. He did get a weight this morning, and they said that he was actually up a kilo. The nursing assistant told me that, but I haven't talked to the family or told the physician or anything, so you might want to follow up on that for me. He does have a saline lock in his right arm, and it appears to be patent, and I did flush that about 4 hours ago, so that should work for you. His neck veins are distended, and as a side light, you guys, as students, you can't see that on the mannequin, so you'll just have to simulate that they're distended. So my recommendation for you is, he has some lab results, which I haven't had a chance to look at because I've been so busy, so if you could check those out and let the physician know, that would be great. His wife called about an hour ago, and like I said, I was busy. She said it wasn't an emergency, so I didn't go in there, so I'm not sure what she was calling about. If you'd follow up on that, would be great. Do you have any questions for me about anything?
Yes. What's his code status?
He's a full code.
Okay. Any urine output?
You know, no, not for me on the night shift, and then on the evening shift there wasn't anything recorded, so I don't know if he didn't void or if they just forgot to record it. I'm not sure.
And he uses the urinal?
Yep.
Okay.
Well, it's in there. I don't know if he'll use it.
That's good. And is there a genogram or an ecomap?
No.
Okay. So we'll kind of make that on our to-do list at some
Okay.
point today.
Okay.
Do you have any questions for her? No?
All right. Anything else?
No? Sounds good. Thank you.
As far as simulation, you guys all okay? Okay, so when I shut the door, you can begin the scenario. All right?